Dr. Epstein with a patient a year and a half or so after 1,900 grafts to the beard. He had two main reasons for getting this done. One is he had some scarring. You can see that, Jackie, if you come in, he had some scarring throughout the area. But the other thing is he had a lack of density, so he was looking for better density. Also, even in the mustache region, you can see how little hair he had. You see that area? There was very little hair in that area. So we basically did 1,900 grafts done by the FUE. He wants to be private, so let me just show you the results, but it's a really nice result. Everything, this area is all filled in. See how full now this whole beard is? If we come across here, his mustache has been filled in all along here. No sign anymore of any of the scarring. So basically, he was able to achieve a really nice result from the donor site scarring, because patients are often asked that. Come around this way, Jackie. You can see that he's able to wear his hair short, no signs of any scarring. And now even with the newer punches, we're able to further reduce the tiny dot scarring from FUEs because they're even smaller. Plus we're using now these hybrid punches. Anyway, this is Dr. Epstein, a year and a half after 1,900 grafts to the beard. Happy patient. Today we're just going to do a bit more filling in, but that's it. Thank you very much.